Hi, my name is Dr. Astha, and in today's anatomy class we will be discussing about the muscles of scapular region. Altogether there are 5 muscles in scapular area, and those muscles I've written a mnemonics for that. So the mnemonics would be SITS, sits, and additional T. So the sits muscle SITS comprises of our rotator cuff muscle. So the rotator cuff muscle comprises of SITS muscle, which is your supraspinatus, infraspinatus, teres minor, and subscapularis. Now, in the muscle of the scapular area, rotator cuff muscle as well as teres major muscle is present. Now let's see the origin and insertion of these muscles. So the first muscle, that is supraspinatus, it originates from the dorsal surface of the scapula, from the supraspinous fossa, so which is present here. So the scapula, the dorsal surface of the scapula, which is this, is divided into upper part, which is supraspinous fossa, and the lower part, which is infraspinous fossa, by the spine of the scapula or the spinous process of the scapula. Now the supraspinous fossa, this gives origin to supraspinatus muscle, whereas the infraspinous fossa gives origin to the infraspinatus muscle. Now coming to the teres minor and teres major muscle. The teres minor, which is also a part of rotator cuff muscle, the upper 2/3 of the lateral border of the dorsal surface of scapula, gives origin to teres minor muscle. So this is our teres minor, this is our supraspinatus, and this is our infraspinatus muscle. So this is the dorsal surface of the scapula. Now let's see the anterior or the costal surface of the scapula. So the costal surface of scapula doesn't have any spinous process, or it just has one fossa, and this fossa is called as subscapular fossa, and subscapular fossa gives origin to the subscapularis muscle. So it is present anteriorly, and this is our subscapularis muscle, which is originating from the subscapular fossa. Now, how does the muscle go and get inserted, and where does it get inserted to? Now the supraspinatus muscle gets inserted to the upper impression of the greater tubercle, which is the top part of the greater tubercle. The infraspinatus gets inserted in the middle impression of the greater tubercle, and the teres minor muscle gets inserted in the lower impression of the greater tubercle. So these sit muscle gets inserted together in the greater tubercle of humerus. Now coming to the subscapularis muscle, which is now coming from the anterior aspect of the scapula. So the muscle also cannot be palpated from the outer, which is the posterior part, and it is present inside, that means towards the thoracic cage. It is coming from here, from inside. It comes this way, it comes under the armpit, and it gets inserted in the lesser tubercle of the humerus. Over here the muscle comes from inside. So this is the outer part, or the posterior part of the scapula. The subscapularis muscle, it comes from the costal surface, which is inner part, and it comes from here and gets inserted to the lesser tubercle of the humerus. So with this we have completed the origin and insertion of the rotator cuff muscles. Now coming to the action of the rotator cuff muscles. The action of the muscle depends on the origin, insertion, and the course of the muscle. All 3 muscles, the supraspinatus, infraspinatus, and teres minor, all 3 are coming from the posterior part of the scapula, from here, right? The supraspinatus muscle, the because the fossa is here, the supraspinous fossa is present here, and the greater tubercle of humerus is present here. So it comes from here to here. When it shortens from insertion to origin. Therefore, from here, let's see how it works. So when it shortens, it pulls the humerus upwards, that is, it elevates the humerus in this direction to cause abduction of shoulder. But since this is a very small muscle and it is not much powerful to cause the entire range of abduction of shoulder joint, so it causes the initial 15 to 20 degrees of abduction of shoulder joint. Now coming to the other two muscles, that is infraspinatus and teres minor. Both of them come from the lower part, from here, and both of them come here and get inserted in the greater tubercle. So this is the course of the muscle. When they contract from insertion to origin, thus pulling the bone, pulling the humerus backside and laterally. So it causes extension in the shoulder joint, and it also causes lateral rotation of the shoulder joint. So this is the action of rotator cuff muscles, the three of them. Now coming to the one more rotator cuff muscle, which is subscapularis, and it has a slight different role, and because it has a different course, and even the origin and insertion is slightly different from the other three. The subscapularis muscle, as I told you, it comes from the inside part. So it comes under the armpit, comes this way and gets inserted in the lesser tubercle. Because it is coming from the medial aspect of the shoulder joint, it causes internal rotation and adduction in the shoulder joint. So this is the role of rotator cuff muscle, how it works. Now coming to the other muscle of the scapular region apart from rotator cuff muscle, and that is our teres major muscle. So teres major muscle gets originated from the lower 1/3 of the lateral border of the scapula on its dorsal surface. It is present right below the teres minor muscle. So there's a groove called as bicipital groove in the upper end of the humerus, which it connects the two tubercles, that is the greater and the lesser tubercle. So this bicipital groove has medial lip and lateral lip. So the teres major muscle goes and inserts in the medial lip of the bicipital groove. Now here it is very important to understand the course of this muscle. Teres major muscle, it comes from the lower 1/3 of the lateral border. So instead of it coming from here and going and getting inserted this side like the teres minor, this muscle, it comes down, it comes to the axilla, it runs under the armpit in the axillary area, and then comes anteriorly from the medial side, the medial lip of the bicipital groove. This muscle gets inserted too. So this is the course of the muscle. Because of this course of the muscle, the action of muscle also is different from the teres minor. Now here in this, because it passes the shoulder joint posteriorly from here behind, so it causes extension of the shoulder joint by pulling the humerus. When it contracts, it pulls the humerus behind, so it causes extension of the shoulder joint. And since the muscle is coming from the axilla or the armpit, and it comes medially and anteriorly to the humerus, this muscle also causes medial rotation of the shoulder joint. So it causes medial rotation of the shoulder joint, and it causes extension of the humerus. So this is how the action of teres major is different from the action of teres minor, which is originating from almost the same place in the scapula. Therefore, understanding the course of muscle is very important, along with the origin and insertion of it. So here with this, I've completed the origin, insertion and action of the muscles of the scapular region, which comprised of your rotator cuff muscle and your teres major. I hope it was clear for all of you, and with this I would like to end this video. Please don't forget to subscribe my channel and like this video. Thank you and bye-bye.